Welcome to Advancing Health. The perinatal period is a delicate time for a new mom's mental health. In fact, 1 in 4 moms experiences perinatal depression and anxiety. Coming up, a look into how a leading specialty hospital for women and newborns developed a program that helps prevent perinatal depression.
Hi, everyone. I'm Julia Resnick, Director of Strategic Initiatives at the American Hospital Association. I am so pleased to be here today to talk with all of you about perinatal depression. I'm joined by 2 experts from Women and Infants Hospital of Rhode Island. We have Shannon Sullivan, who's the President and Chief Operating Officer, joined by Dr. Caron Zlotnick, who's the Director of Behavioral Medicine Research. Shannon, Dr. Zlotnick, so happy to be here with you all today.
Thank you, Julia.
Thank you for having us.
So let's dive right in. Shannon, I want to start with you. Can you start with some background on your hospital and your community?
Sure, absolutely. So, Women and Infants is one of the largest freestanding women's health hospitals in the country, exclusively dedicated to serving women and their families. We do about 8,700 deliveries annually. We have an 82 single bed level 3 to 4 NICU with about 1,100 discharges annually. We have a comprehensive women's medicine program that includes an inpatient unit, GI, OB medicine, endocrinology, basically anything that cares for women during the course of their lifetime. We are also the only OB hospital in the region that is an obstetrical tertiary care hospital. Plus, we have one of the largest NICUs in New England and actually on the East Coast. So we care only for women here, only for women and their infants. And we feel really strongly about their care being really high quality.
That's amazing. And I love that whole life cycle from when they're young until when they're much older. And for this podcast, we're really focusing on your hospital's pregnancy and postpartum care. So, how are you thinking about that whole continuum and making sure that that care extends to women after they give birth?
I think it's important to note that even though I'm the president and chief operating officer now, my background is I'm a perinatal social worker. I have a master's in social work and I practiced in this setting for about 10 years before I got into leadership. And so I can tell you we're particularly dedicated to the pregnant and postpartum care, especially the mental health needs of women across the state. And so, currently when you look at morbidity and mortality across the United States, in the pregnancy and postpartum period, suicide and overdose are climbing higher in that list and mark 2 of the top 10 reasons that women get sick and die during their pregnancy or 1 year postpartum. It's a particularly delicate time for women and their families, and that's underscored not just by the data and the research, but a lot of the anecdotal stories that you'll hear, across news outlets. And so it's incredibly important for us, being that we are a women's hospital, being the types of patients that we care for, that, like I said, come from a wide variety of backgrounds. And given what we know about women in their pregnancy and postpartum period and what's happening nationally. And so there are not ever enough resources to care for women during this particularly delicate time during their life. And so we've really spent a lot of time in the last 25 years investing both in the research and in the care of women.
I think what your hospital is doing is so important because it connects the research in this space with the care. So, Dr. Zlotnick, you're an expert in this space. What were you seeing that helped you know it was so important for your hospital to do more around postpartum depression care?
Well, my expertise and focus is preventing postpartum depression. When I first started at Women and Infants Hospital, which was many, many moons ago, Women and Infants has a large OBGYN clinic. The majority of their perinatal patients are on Medicaid. And this is a very high risk group of women who are at risk for postpartum depression. When I started at Women and Infants Hospital as a clinical psychologist, I treated many of these perinatal patients with mental health issues. So I heard firsthand the struggles of these patients with mental health issues. We know society, you could even look on Facebook, tells us that having a baby is the happiest time of your life. And these patients really experienced a lot of stigma and shame around their mental health issues. That got me thinking that, screening and treatment is very important, but prevention is better and more cost effective.
So talk to me more about that. What does prevention look like?
Well, there's no proven or consistent way to predict who might be at risk for postpartum depression. It's probably more cost effective to offer a prevention intervention like our program to prevent postpartum depression to every pregnant woman rather than guess who may benefit from the program. So, the ROSE program, reach out, stay strong, essential for mothers with infants. So, the overall aim of ROSE is to reduce suffering and increase joy for as many new mothers with an infant as possible during a time which can be very stressful and lonely. The ROSE program is administered during pregnancy, usually in small groups consisting of 4 sessions during pregnancy and a postpartum check in post delivery. The ROSE program tries to focus on those risk factors that for postpartum depression that are amenable to change. So the session topics focus on improving relationships and support system, effective strategies to communicate, like how to say no, how to ask for help, very important in the postpartum period, self-care strategies, ensuring that new moms have me time, that they don't get depleted, and goal setting. We also provide information on different types of stresses that can occur in the postpartum periods, such as baby blues and what is involved with postpartum depression and how to identify it. We try to destigmatize it. It is a common struggle for many postpartum women. 1 in 7 experience a full-blown postpartum depression. We tell them how and where to reach out for help. To accompany our sessions, we have a patient workbook, which is available in English and Spanish. We did a very large implementation study in which we had 98 sites across the country delivering ROSE. So some sites delivered ROSE virtually, others in person. Now, what is important with delivering ROSE is that you don't need mental health expertise. So we had the full spectrum of people delivering ROSE, clinic nurses, doulas, medical assistants, navigators, community health workers, and actually mental health providers. And the training for those who want to deliver ROSE is relatively an easy process. The ROSE website, which is hosted by Women and Infants, has all the training intervention materials. The training videos, as I mentioned before, the patient workbook, and ROSE itself is highly scripted. So there's a scripted manual there. We have slides for virtual delivery and all free of cost.
That's amazing, and I think just having this publicly available is so hugely important, and also, there are so many communities that don't have enough mental health providers that it's really powerful that you can be a lay provider or just a medical provider. I wanna pivot slightly. I know that your hospital is doing work in perinatal depression and supporting postpartum women and their families beyond the ROSE program. Shannon, can you talk a little bit about what else is going on?
One of our more proud moments is how dedicated this organization has been to the totality of care of women, not just their medical care, their psychological care, their socioeconomic care, their social determinants care, in really making sure that they support the whole woman and their family for many decades now. And that is mostly our premier program, the one that, Dr. Zlotnick was just talking about that she had started in, is our day hospital program and our partial hospitalization program, which opened 25 years ago. It was revolutionary at the time. I would argue it's still revolutionary today. It was a program for assessment and then care of pregnant and postpartum women with perinatal and postpartum depression. And what was so revolutionary about it is it was a program that allowed women to get that intensive outpatient care, so coming every day, but with their baby. Oftentimes, you would find women were separated during treatment from their children, and then psychiatrists, psychologists, social workers couldn't really assess bonding. They couldn't really assess how women were doing in caring for their infants, as well as it didn't allow women more time to be able to bond under the professional treatment that they received. So that was opened late 90s, early 2000s, and still remains actually one of the only in the country and cares for a wide variety of women really across the region. And since that time, more recently, we've increased the amount of women and the types of care that we're providing. So it's no longer, postpartum and perinatal anxiety and depression. We also have an OCD track. We found there's a higher prevalence, especially for women who've previously experienced obsessive compulsive disorder in the postpartum period. That can be a really difficult time. So we've opened an OCD track to the partial hospitalization program. And most recently, within the last 6 months, we've reopened a substance use track so that we can, try to work together. We work together with a Suboxone program. We have family medicine who's been coming in and helping us to care for not only the patients, but also the babies that are in that program with their mothers. And so we're really trying to diversify the types of patients that we're caring for in that program, all along the lines of treating mothers while keeping them together with their children. It's really been well received within the community. We can't keep up with the volume, as you can imagine. And so we're continuing to find ways to grow it over time. Two other ways that we're really looking is Dr. Emily Miller, who's the Division Director of Maternal Fetal Medicine here, has an R01 grant for the Compass Plus program, which embeds social workers and case managers within obstetrical practices for that assessment, brief intervention, and then referral. And then our newest program that we're most proud of that hasn't started yet is our mobile van program. CVS Health recently gave us a grant to purchase a mobile van. And in that mobile van, we'll have a nurse practitioner and community health workers. What we know about our particular community is especially the patients that Dr. Zlotnick was talking about, our high Medicaid clinic on site. It's hard for patients to get back. You're asking them to deliver a baby and then they might not have reliable transportation. They might not have reliable childcare. And, I will tell you, as the mother of three who had reliable transportation, who had reliable childcare, getting out of the house with my children during that postpartum period was really challenging, especially to take care of myself. And so the postpartum van is going to be able to go out and really provide that care in communities to patients in their home and in the van, and be able to identify and then refer either to Rose or to Compass Plus or to the day hospital program when they're meeting with patients in their own community and really seeing what's happening in their home.
That's really amazing and impressive work, and please keep us posted on all of these new programs. It sounds like they'll be incredibly impactful. To wrap things up, I just want to pick your brains about what you've learned while implementing these programs, because I'm sure we have people listening who are thinking, how do I do this in my community and in my setting? So, what do you think those key takeaways are that others could learn from your experiences to set up their own programs?
I think execution is always a problem, and a lot of that has to do with, these are complex clinics, these are complex patients, and everything, of course, requires resources. And all of those things make it more complicated. I would say that one size does not fit all for everyone. We've seen many people fail trying to implement a postpartum day hospital program. We've seen many people with the best intentions. And so you have to partner with a wide variety of people to get any of these programs off the ground. Your payer contracting teams, your operational leads, your clinical leads, your patient liaisons, your community health workers. And so it really does require a multidisciplinary approach to execution, and probably much longer than any of us ever like when it comes down to that. But I would say if you get the right multidisciplinary team embedded in doing your work, you can do it, but you certainly can't do it alone.
Anything to add, Karen?
I can say the organization has to have the capacity to implement a program like Rose. What I would also like to say is that in recruiting potential sites, It was very heartwarming to hear from administrators, directors of programs, really expressing a deep passion about improving maternal mental health. In our study, we realized that it makes a difference if you have a cheerleader. Best if leadership is the cheerleader, but even those who are delivering rows. And I just want to mention that on our website at Women and Infants Hospital, we actually have an implementation plan for agencies and hospitals that are thinking about implementing the ROSE program that really helps these sites to think through what it is that they need to do to successfully implement ROSE, or actually any program similar to ROSE.
Fantastic. So I think 3 key themes that I heard was that you need passion, you need partnerships, and you need patience. Shannon, Dr. Zlotnick, thank you so much for sharing this fantastic work that you're doing. To our listeners, you should check out the ROSE program website on the Women and Infants Hospital website. Thank you all for listening, and thank you again to Shannon and Dr. Zlotnick for your passion for this issue and for sharing your expertise with our listeners.
Thanks so much.
Thank you for giving us this opportunity.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.